Welcome to the Women's Digital Health Podcast, a podcast dedicated to learning more about new digital technologies in women's health. We discuss convenient and accessible solutions that support women with common health conditions. Join us as we explore innovations like mobile health applications, sensors, telehealth, and artificial intelligence, plus more. Learn from a board-certified anesthesiologist the best tips to fill in some of your health experience gaps throughout life's journey. Hello, and welcome to the first episode of Women's Digital Health. I am your host, Dr. Brandy, and our first episode is going to focus on why did I start Women's Digital Health? And I am pretty nervous. I'm pretty nervous because the story I'm going to tell is pretty personal. It's relatable, but it helps me kind of understand, that everybody has a way of recovering from challenges in their life. And it's one of the reasons why I started it. So let's go back to the pandemic. When it was called a pandemic, I took a hit like everyone else. I lost some dear friends and family who died way too young. And it has had a pretty emotional impact on me. And I would say Women's Digital Health is in response to some of the lessons that I learned during that time. Women's Digital Health is an expression of my resilience. It's my way of saying I'm going to get back up and I'm going to take the lessons that I learned and improve the health of our community. During my lowest moment, I was trying to figure out how to grieve because literally I was grieving over and over again. I kept losing people over and over again. In the past, I would have a major loss, maybe months or years apart. But during the pandemic, I was losing people sometimes days, hours, and weeks apart, and I couldn't even recover from the previous loss. So I was looking and using every resource that I had, including religious leaders. And in particular, I asked one, how do you grieve? How do you grieve when so much grief is happening all at once? And to simplify what that religious leader said is that you grieve with your community. And so one of the reasons I started Women's Digital Health was to help build that community. So the next question becomes, okay, build a community around what? Some of the loss that I experienced was what I saw inside the hospital, which was the loss of young pregnant women. Many of them had acquired COVID before the vaccines were available, and it had devastating impacts on them and their families. And even when the vaccines were made available, there was a ton of confusion, which resulted in delay in access to their care that also had devastating impacts on women in their community. To be honest with you, I didn't have the energy to explain everything. And even when I did, I was participating in health clinics and panel discussions. It was hard to relive everything that was happening behind the walls of the hospitals. A lot of people just could not see or appreciate the seriousness of what was happening until they were personally affected. And I started to realize that things were happening so quickly that the only resources that people could rely on were news and social media. And so the majority of the commentary and speculation was not being offered by healthcare providers that were actually experiencing it, because we were too tired to really respond directly to it. And I'm sure by now you've heard this sentiment echoed by a ton of healthcare professionals. And consequently, now we are all experiencing the consequences of how healthcare is now being delivered. You might be noticing some changes in your healthcare experience. If you're lucky, you got to keep your same healthcare provider. But like many of us, there have been a lot of changes, including with your healthcare provider. Many of you might be experiencing health data transfers, meaning that okay, you've got a new doctor or a new provider, and now you've got to make sure that they have your new medications, your new medical conditions, and that takes time. That takes away from the opportunity to get some of your problems solved in the healthcare clinic. The second challenge you might be experiencing is expectation mismatch. So your conditions are addressed, but sometimes you only got 15 minutes. And a physician or healthcare provider might be thinking that you have the same level of knowledge as they do as they try to explain everything that's going on. And you walk away thinking like, wait, what? What just happened? What did you just say? What is that? Say that again. And so the question becomes like, what do we do now? So the community of women's digital health is here to fill some of those health information gaps. You might be noticing that you are going on WebMD and Google trying to get those questions answered. And I applaud you for going and trying to solve some of these issues. But the honest truth is that many people walk away from Google or WebMD feeling more lost, more confused, and not really getting their questions answered. And certainly, we as physicians want to make sure that you have the best quality of life. And so Women's Digital Health is there to answer some of these common women's health topic questions about fibroids, breast cancer, stress management, weight loss, sexual health in a way that's more human. To do that, we talk about the use of technology. If you have a smartphone or you have an email, you are already tapped into the majority of healthcare technologies that exist that can improve the quality of your life. And the job of Women's Digital Health is to really help you understand how you can tap into these technologies to get a better healthcare experience. I understand the frustration that many of us are experiencing, and particularly women who have taken not only a physical blow from the pandemic, but also financial blow. And so talking about technology is a great way to address the convenience and accessibility factors that all of us are looking for in the next chapter of a healthcare experience. So I started Women's Digital Health, 1, to build a community, 2, to fill those gaps in your healthcare experience, and 3, to really address some of the ways in which technology can fill those gaps. And I hope that you subscribe and support us. And thank you so much for listening to the first episode of Women's Digital Health Podcast. Thanks again. Thanks for listening to this episode of Women's Digital Health. If you like this episode, subscribe to Women's Digital Health on your favorite podcast platform. In our second episode, I'll go into more depth about what anesthesiologists do and why I care so much about the technology you're using at home. In episode 3, I'll talk more about what exactly digital health is and what does digital health mean to me as an anesthesiologist. If you want to know even more about how to use technology to improve your health, subscribe to our newsletter on womensdigitalhealth.com. Follow us on Instagram, Facebook, YouTube, and LinkedIn.